Ready, set, go. They bounced back so fast from this, it was amazing. With our other labs, they had the big long incisions, and we had to wait 14 days. And if you can imagine trying to calm something like this down for 14 days, it doesn't work.
Laparoscopic spay is where we do a spay, but instead of doing it the traditional way, we use a small camera to go in the abdomen. So one of the major advantages is that I can see everything much more clearly.
When you're doing it the traditional way, your visual field is very minimal. When you're doing it laparoscopically, I can see all that blood vessel. So it means post-operatively, I have so much more confidence of what's going on in your dog's abdomen. I know there's no bleeding. Eliminating pain is probably the biggest reason why I recommend laparoscopic spays. When you're doing a traditional spay, you actually have to break down a ligament that's attaching the ovary to the musculature. That's the part that actually hurts. With a laparoscopic spay, that ligament is actually cauterized or burnt, and so there's actually no ripping, there's no tearing.
That has been associated with a decreased amount of pain after surgery and a faster recovery after surgery as well, which is great because that is our main goal.
This is what we actually use to grab blood vessels and cauterize them, which is basically using heat to close the blood vessels. And then this little button, push this, and a little blade comes out to actually cut the tissue.
We use the laparoscopic equipment to do liver biopsies. We can also do pancreatic biopsies.
Another life-saving benefit to laparoscopic surgery is a gastropexy. And what you do with a gastropexy is you're actually attaching a dog's stomach to the musculature of the body wall to prevent it from flipping. And when it flips, it's called bloat, and that's life-threatening.
There is your belly button, and there, and there is where they did the surgery. And you can see that they're almost the same size. If I ever got another female dog and had to have them spayed, I'd choose the laparoscopic every time. Yes, less pain for you, and makes me feel better.